Patients often ask me, usually when I'm doing their vasectomy, Dr. Chan, why did you decide to go into urology? Hey friends, welcome back to the channel. I'm Dr. Robert Chan, and in this video, I'm going to share with you the top 5 reasons why I went into urology. I hope this will be of value for any potential medical students or anyone who's just wondering why I love my job and why urology is such an amazing field. So let's get started. Number 1, I get to utilize my ball handling skills. I loved playing basketball as a kid. And so now that I am an adult and a doctor, I get to utilize all my amazing ball handling skills. Number 2, I get to operate with a robot. A lot of the procedures that we used to do that required a big incision on the abdomen, now they've become tiny keyhole incisions using a robot that we control. It's sort of like that movie, Pacific Rim, where you're controlling this giant robot. These machines cost like $1 million, $1.5 million. Number 3, there is never a dull moment. You would not imagine the kind of things that we as urologists have pulled out of people. I know one of my colleagues has pulled out over 30 razor blades out of a guy's penis. We pulled out carrots. I've actually pulled out one of those magnetic balls that stick together. That one was particularly difficult. Number 4, instant gratification. I think one of the main things that medical students have to decide during their clinical years is whether they like to be in the operating room or not. I think that's one of the most amazing things you can't really do in any other job. And the thing about surgery is the most rewarding is sort of that instant gratification. I can help somebody who 1 minute is writhing on the ground in pain because they've got some kidney stone, and then just a few days later, make them all better. That's pretty awesome. And finally, number 5, reason why I decided to go into urology. This is more just kind of advice for potential medical students trying to figure out what they want to do with the rest of their lives and matching into residency. I think what you see as a medical student, it's a very small glimpse, and there's no way of knowing for sure whether you're going to like it or not, whether you're going to enjoy treating these type of patients or not, or doing these type of surgeries. The only way to do it, I think a lot of times, is to kind of find your tribe. In medicine, a lot of times, there will be people that you resonate with, that seem pretty similar to you, that you could see, you look up to, and you could kind of see yourself in their shoes 10, 20 years down the line. So that was one of the ways that I kind of decided, was that I looked at some of my professors who were all very amazing surgeons and doctors, and they were happy. They seemed like they really enjoyed what they were doing. They seemed like they had a lot of fun, and they liked helping people. And so that's kind of what helped me kind of make my decision, was seeing people similar to me who were obviously far smarter than me, who had made this choice to go into urology and loved it. So there you go. Here's my top 5 reasons why I went into urology. Thanks for watching. Check out some of my other videos and be sure to subscribe if you haven't already.